Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us on The Big Weck's Buffalo on the Rise today is Dr. Christian Miliotto from WNY Pain Relief. Doc, how are you?
Splendid.
Splendid. Yes, indeed. You know what? I think that whenever I talk to you, I think about the things that you've helped me with, and some of the pain that I've had and some of the different afflictions that I've had from cycling. But is it a common misconception, or does this really happen, that people just ignore their pain symptoms? They just have a tendency of explaining them away to something else. They don't pay attention to them, and then they get to the point where it's even harder to get rid of.
Yeah, I see this time in and time out with people, right? When somebody comes in for a consultation with me, it's almost always the same story, but a different correlation to their pain, whether it's back pain, knee pain, nerve pain like neuropathy. They've had it for a long time. They noticed issues in the past, but then they didn't address it or come in to do something about it until the pain had been chronic and it had changed their quality of life. And I think a lot of it has to do with the understanding of how the body works, and one of the things I always ask my patient is I say, so if you feel lightheaded or dizzy and you think that you might have a problem with your heart or your blood pressure, what do? You go see the doctor, right? Yeah, I get it addressed right away. Well, when you wake up and you can't get out of bed and you're feeling shooting pain down your leg, why do you just take a Aleve or Tylenol and think it's going to go away when it's something a lot more serious than that and it needs to be addressed? And yeah, I myself included, we're all human, and we've all made mistakes, but I've been there too, where I had pain and I thought it was going to go away, and guess what? It didn't, and I had to do something about it.
Well, do people get are they of the opinion, let's put it this way, it's just going to get better? I have a little back pain, but maybe I slept wrong. Maybe I was out gardening and I bent over and I pulled a muscle, or whatever the case may be, and they just think in a couple of days it'll work itself out. And then sometimes things, they may go away for a bit, then they'll come back. And unfortunately, in my experience, when they come back worse.
Right, they do. And you're right, and that's the hard part about when's the right time to take action, And the best way I can kind of describe it to people is, if you hurt yourself and it's a major part of your body, your back, your knees, your hips, your joints, if you feel soreness for more than 24 to 72 hours, that's actually the time frame for acute pain to become chronic pain. And if it doesn't completely dissipate and you don't regain full function, it could be something that's a little bit more serious. And the other thing you have to take into account too is your age. If you're 18 or 19 years old and you slip and fall, you'll most likely be okay. But if you're 40, 50, 70, 80, and that happens, you're not okay. And it needs to be assessed, and you need to have it looked at and make sure that structurally you're okay. And I've seen it a bunch of times where somebody fell and hurt their back. They came into me a few months later. They said, it's just nagging. And I get x-rays and they have a fracture in their spine. That's something you have to worry about and you have to be very cautious of.
How many times do you get a patient that'll come in and say, I'm just getting old. I'm getting older. I have to live with it. There's nothing I can do about it. And what do you say to them?
Well, that's 95% of the people that I work with. And I don't blame the patients themselves. I blame the doctors. When you go and you see a doctor and you have musculoskeletal pain, bones, joints, and ligaments, 9 times out of 10, the doctor you're working with can't properly address it. Your primary can send you for imaging, but usually you guys will know that they'll refer you out or give you some pain medication. A neurologist might do tests to analyze what type of nerve problem you have, but once again, it's pain medication, injection, or referral for physical therapy, chiropractic, or otherwise. But the truth of the matter is, age actually has nothing to do with it. For example, in my office, we utilize researched and evidence-based medicine. So what that means is we're actually using treatments that can help tissue heal. Most people are told you can't heal nerve damage, you can't heal musculoskeletal issues, you can't heal a damaged disc. Yes, you can. Spinal decompression is the most advanced treatment in the world for people to avoid back surgery. We have 2 special machines that are customized for nerve and joint damage, so I can help people with swelling, edema, balance issues, sciatica, neuropathy symptoms like numbness, burning, or tingling. I can rehab balance issues. I can rehab weakness and heaviness in your legs. And you know, I always tell people, you don't want to just believe what you hear. You need to come in and you need to meet me. You need to see the clinic. You need to come for a tour of the office. You need to come to my educational seminar, and you'll learn that you can change your life. It doesn't matter how old you are.
So the evaluation is very important. Let me ask you one other thing too. And we only have about a minute and a half left, but if somebody has to have surgery and they've had surgery done and they have residual pain after surgery, can you work with that?
Yes, we have several protocols that are actually specific for post-surgical patients where we can clean up scar tissue and inflammation. I can tell tons of stories about it, but I've had people come in with fusions. They couldn't stand or walk. We had them golfing again. We gave them range of motion and strength. So yes, we can help you pre or post-surgical. The best thing you can do is just come in for your one-on-one evaluation and let me assess you individually. You'll get more out of us in an hour of consultation than you might have had with a decade of doctors you've worked with.
You'd rather have somebody come in for a consultation and have them say, look, I can't do anything, than have somebody just suffer for the next 10 years with something you could have fixed.
Yeah,
right?
I mean, it's very rare that I turn a patient away, but that's the difference with me, is I'm just honest. If I don't think I can help somebody, I'll let them know, and I don't want to set goals for the person that can't be obtained. But 9 times out of 10, the person that comes into my clinic can have an extreme change in their quality of life and function, and most importantly, their pain.
Dr. Christian Miliotto, Western New York Pain Relief, thank you very much.
Thank you, sir.
For more information and answers to your questions, contact Western New York Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional consideration for the preceding segment was provided by Western New York Pain Relief. And you can join me weekday mornings 7 to 9 a.m. on The Big Whack.